Hello, it's CJ. Are you 30 weeks pregnant or do you know someone who is? If so, you're either going to want to stick around or share this video with someone who you think might benefit from the information provided. Today I'm going to talk about your tiny human, your symptoms, what's normal and what's not okay, and the 4 things that I, a women's health nurse practitioner, recommend that you do in the 30th week of pregnancy. At 30 weeks, your baby is now measuring right around 16 inches. That's 40.5 centimeters from the top of their head to the bottom of their feet. Your little one this week is roughly the same size as a head of green cabbage. Developmentally, your baby's brain is growing rapidly these days. The lanugo, those soft little hairs that are covering the body, are starting to disappear. Inside your baby's bones, bone marrow is starting to form, which is essential for life outside of your uterus. And here's some really good news. If you were to deliver this week and you have access to excellent neonatal care, your baby now has a 95 to 98% chance to survive. As far as your symptoms go, it is very normal for you to feel tired these days. After all, you are making a human. You may be having some mild swelling in your hands and your feet, especially if you're on your feet all day. You may be a little bit moodier than you normally are, especially if you're not sleeping well at night. And if you notice that your feet have gotten bigger, that is very common, and that is because of the relaxin that is being produced by your placenta. What symptoms are not okay right now? 5 or more cramps in 1 hour. Water running down your leg that isn't urine. It's not normal to bleed heavy enough to saturate a pad, and it's not okay for your baby to not move like he or she normally does. Also, symptoms of preeclampsia, the worst headache of your life. Changes in your vision such as black spots, flashing lights, or tunnel vision that occur at rest. A burning sensation in your liver. Your liver is located behind and below your right breast. And if you have a sudden onset of severe swelling, your face looks like a blowfish, please contact your OB provider right away. And finally, here are the 4 things that I recommend you do in the 30th week of pregnancy. Number 1, start thinking about how you plan to deal with the discomfort of labor. Are you aiming for a drug-free delivery, or do you have an epidural in your future? Number 2, schedule your maternity photo shoot if you haven't already done so. Number 3, start creating that baby registry. And number 4, pay attention to your baby's movement every single day. And if at any point you feel like something isn't right, please trust your maternal instinct, listen to that voice in your head, and call your local birth center. I do hope that this information has been helpful, and that if you have any questions, you'll let me know in the comment section below. That's all I have for today. This is CJ. I'm at your cervix.